The Committee on Health and Human Services and Homelessness for the purpose of hearing an agenda scheduled for Thursday, February 3rd, 2022, 9 a.m. agenda. Before we begin, members and those in the audience or those on YouTube watching and our speaker's office would like to report some of the conditions and rules regarding the hearing. In order to allow as many people to testify as possible, especially with Health and Human Services agendas, we have instituted a 2-minute per testifier time limit. You will be given a warning to wrap up, and then we will unfortunately have to move on after 2 minutes. Because of morning hearings must adjourn prior to the noon floor session. Just let you know, not all testifiers may have the opportunity to testify. However, I do want you to know that we do have all the written testimony submitted and shared amongst all the members, and our members are very intelligent and they read. Okay, please keep yourself muted and your video off while waiting to testify. And then once you completed your testimony, please shut off your video and mute yourself. Okay. That, by the way, in the Zoom chat, the only people that will see it is the technical staff. So please use it if you have technical issues. If we are disconnected unexpectedly, we may need to rejoin the meeting, or if it's really bad, we will have to reschedule. Okay, let's see. Please avoid using any trademarks or copyright images. They're not allowed. And please refrain from use of profanity and uncivilized behavior, such those behaviors will be grounds for removal from the hearing. Okay, we're all cool with the rules, members? Okay, going on to the first measure of the day, HB 1581, relating to homeless. The coordinator on homelessness, DHS.
Good morning, Chair Yamane, Vice Chair Tam, and members. I'm Scott Morishige, the Governor's Coordinator on Homelessness and Chair of the Hawaii Interagency Council on Homelessness. I appreciate the intent of this measure and really appreciate the legislature's recognition of challenges facing homeless outreach providers. In the interest of time, I'll stand on my written testimony offering comments. Thank you.
Thank you. Okay, National Association of Social Workers. All right.
Here we are. Sorry, aloha, Chair. Chair Yamane, Vice Chair Tam. My name is Rebecca Gardner, testifying here on behalf of the National Association of Social Workers Hawaii chapter. We come here in strong support of this measure. We especially appreciate the provisions in this that remove the worry of criminal or civil liability. This allows social workers to focus on the work at hand. So we appreciate this measure and look forward to testifying on this in the future. Thank you.
Thank you. Hawaii Psychological Association.
Good morning. I really want to thank the chair and the committee for introducing this important legislation that really stresses the importance of outreach, which is the best practice for the homeless. You know, as a psychologist, we're asked to empathize with our clients, and it's hard to imagine being homeless, but in order to be expected to go to someone's office, you need a calendar, a phone, maybe a watch. These things get stolen. Even to take a bus costs money that they may not have, etc. Or even to walk a short distance, you got all your possessions with you in a suitcase or what have you. So we try to meet our clients, where they're at, and they happen to be on the streets, but they may move to private property because they don't want to get arrested for trespassing. And then there's a real barrier to these outreach workers who we want to support, who are doing such vital and important work. And we certainly don't want them, to face criminal or civil penalties. So Hawaii Psychological Association is very much in support of this bill. Thank you.
Thank you. Okay, comments provided by the Department of Budget and Finance. Kealoha West Oahu in support, Hawaii Health and Harm Reduction Center in support. Members, any questions? Okay, Vice Chair.
I have a question for Mr. Morishige. As under our current laws, how long does it usually take for someone to file a complaint or put in a call regarding a homeless person on a on someone's property? And how long does it really take for a service provider to administer those services while having to contact a property owner? Do you have an estimate?
Well, thank you, Vice Chair. So I think it really varies depending on the circumstances. I think what's problematic sometimes is there may be private property where the owner is not present within the state, or in one instance, there's privately owned land where the company that owns it actually has gone defunct. And in those situations, it can be very difficult to get consent for someone to come on, because it's just very difficult to reach the private property owner. And I think that does delay sometimes the response of homeless outreach providers. It really varies depending on the situation. In other instances, it can be very quick if we know who the private property owner is, and we can just call them, they'll give permission for an outreach team to come out. But in other circumstances, it can delay the response, and not only for provision of services, but also if there's any enforcement action that needs to be taken. The inability to locate the private property owner is sometimes a challenge with that.
Okay, thank you. I have no further questions.
Okay. Okay, the chair has questions for Mr. Morishige. Mr. Morishige, in this bill, as a social worker that provided services, it gives the provider civil and criminal liability protection. Is that correct?
That's my understanding of
Right.
the bill as it's drafted.
Okay. So that means if a provider damages private property or property on that, let's say damages a fence to get in, damages a car, a door, does some other, I guess, because it's criminal, right? Some type of other questionable behavior. Does that mean now they're protected from liability, from being responsible?
Potentially, that's my reading of the bill as drafted. In my testimony, I provided comments that the legislature may want to consider narrowing the exemptions similar to exemptions from civil liability given to other first responders.
Right, but this one gives them civil and criminal.
Correct.
Right? So that means then certain behaviors, much farther than, let's say, trespassing, criminal behavior by these, providers or whatever, then they would be, I guess, the only recourse then, if there was this discrepancy, is that correct, from what some of the legal opinion is, which would then be is that all these private landowners would then have to sue either the state or these providers in order to determine what is wanton, the language in the bill, wanton or gross negligence. I'm not a lawyer, so I'll leave that to you to understand the potential effects of giving providers this flexibility.
No, that is my interpretation of the bill as well, Chair. And again, the recommendation is to consider more narrowly tailoring at least the civil exemptions from liability to emergency situations, similar to what's offered in statute for first responders. And for criminal liability, I do agree that there's potential concern that it's broad exemption from criminal liability as currently drafted.
Okay, so just out of curiosity, then because of the exemptions are not stated, I mean, it's global, and I know my vice chair has a really big heart, so he was trying his best, to make sure that the services providers get every opportunity to help. But in this case, if a provider did something even unintentional, but would result in, let's say, criminal, what would be determined as criminal property damage or some type of other, criminal act, let's say, whatever. Would that then fall under this new law, and then they'd be exempted to be allowed to do that?
I believe that's a plain reading of the bill, Chair.
Okay. All right. Is that worrisome, Mr. Morishige, in regards to what that, I mean, I'm not saying that would happen, but in the process of trying to help, again, non-emergency, right? Because in emergencies, we have Good Samaritan protections, right? So in that case, that's not what we're talking about. But we're talking about in the service contract delivery. The way this could be interpreted then is that there would be no then recourse, either civil or criminal, on those kind of situations, Mr. Morishige?
Yes, thank you, Chair. I do agree that there's potential concerns about how broad the exemptions are currently. And as you noted, I mean, there are exemptions in our statute for first responder, like emergency situations. And so I think if this measure proceeds, maybe that section of statute could be clarified to more clearly state that would also apply to homeless service providers, if that's something the legislature is supportive of.
Okay, thank you, I appreciate that. Thank you. Okay, members, additional questions? Okay, seeing none, moving on to HB 1406, relating to improving access to psychiatric care and for Medicaid patients, Department of Health and Human Services. Sorry, Department of Human Services.
Thank you. Good morning, Chair. I'm Judah Moore-Peterson. I'm the MedQuest Administrator, and on behalf of the Department of Human Services, we stand on our written testimony, appreciating the intent and providing comments.
Okay, thank you. Nice to see you. Okay, Hawaii Psychiatric Medical Association.
Good morning, Representative Chair Yamani, Vice Chair Tam, and members of the Committee on Health, Human Services, and Homelessness. Thank you for the opportunity to testify today. My name is Marva Lawson. I'm testifying on behalf of the Hawaii Psychiatric Medical Association in support of House Bill 1406. What do we know? Mental health conditions impact 1 in 5 adults in the United States. Anxiety, substance use disorders, and depression are often chronic conditions, just like diabetes and heart disease. Depression affects productivity at work, relationships, social functioning. It is the leading cause of disability in the United States, and it costs nearly $210 billion annually. Yet only 50% of people with depression receive mental health care or treatment. Mental health disorders diagnosed during adolescence and adulthood are rooted in early childhood experiences. Stigma, lack of awareness, and inadequate access to resources can delay diagnosis and treatment by weeks, months, or even years. House Bill 1406 encompasses the collaborative care model, and I'll refer to it as CCM. Why support the collaborative healthcare model? CCM is effective and efficient. It has been demonstrated to increase access to mental health and substance abuse treatment, reduce stigma related to mental health care, improve patient outcomes, as it ensures that children grow into resilient, healthy, and productive adults. It increases patient and provider satisfaction, and will save the state of Hawaii money. For every dollar spent, up to $6.
Dr. Lawson, can you wrap it up in a final sentence, please?
CCM delivers effective mental health care in the primary setting. It is patient-centered care comprised of a primary care provider, a behavioral health care manager, a psychiatric consultant, a psychiatrist who is a psychiatrist.
Okay, thank you. Okay, moving on to Queens Health Systems.
Good morning, Chair, Vice Chair, members of the committee. My name is John Garibaldi with the Queens Health System. We're going to stand on a written testimony providing comments. Thank you very much.
Thank you. We have Dr. Jeffrey Akaka.
Hello, Chair Yamani and Vice Chair Tam and members of the committee. I stand on my written testimony, but I'm available for questions if you have any. Thank you.
Okay. Thank you. Okay, Peggy, Aloha Care.
Good morning, Chair, Vice Chair, members of the committee. Peggy Mearswa with Aloha Care. I'll stand on our written testimony in support of the measure. Thank you.
Okay, thank you. AARP.
Aloha Chair Yamane, this is Kaylee Lopez. Thank you for having this bill and hearing this bill. ARP supports the legislation as drafted. However, we do have concerns about the requirement for the behavioral health management inclusion in there. And the main thing is, it's required for visits that aren't in the office, but are required for visits in the office, but outside of the office, but not in the office. And, I'm pretty sure it's worked out as to how those multiple providers get compensated. It just seems to add to the cost. And so our concern is just if that's seen as an additional barrier to service. Other than that, thank you.
Okay, thank you, Director. Okay, American Psychiatric Association in support, Hawaii Substance Abuse Coalition in support, Dr. Helen Blaisdell Brennan in support, Randolph Hack support, Stephen Katz provided comments, Rika Suzuki in support, Eric Lindborg in support, Dr. Julianne Aluez support, Hawaii Primary Care Association in support.
Hi, this is Eric Abe on behalf of the Hawaii Primary Care Association. I'll summarize our testimony just to highlight a couple of big points. First, regardless of what happens today, the federal government will still require telephonic telehealth to be provided for Medicare and Medicaid recipients. Second, Medicare and by extension Medicaid implements telephonic telehealth as interactive telecommunication systems and applies it to all services that are already compensable under contract with some limitations. Third, you may want to take a look at the 2022 Medicare Physician Fee Schedule Final Rule dated November 2nd, 2021. Because under this regulation, audio-only communications technology may be used for the diagnosis, evaluation, or treatment of mental health disorders furnished to establish patients in their homes under certain circumstances. Thank you.
Okay, thank you. Okay, Naomi Bickle, support. Ashley Maid, support. Megan Arajo, support. Gregory Nico Geisen, support. Yukobo Ahmed, support. Okay. Anybody else wishing to? No. Okay. Members, any questions? Okay. Moving on. HB 1638, making an appropriation for the Kona Hospital site assessment. I have a number of testifiers, none that said they were going to be on Zoom, but if any of them made it, want to testify now? Okay, not. Budget and Finance provided comments. Hawaii County Council, District 8, Dr. Inaba provided support. County of Hawaii provided testimony support. Kuakini Hawaiian Civic Clubs of Kona support. Kona Community Hospital, West Hawaii Region, HHSC in support. Douglas Prien support. Hawaii County Council, Council Member Rebecca Villegas in support. Kona Community Hospital in support. Tyler Rodimer support. Teresa Holdred support. And Shannon Rudolph support. Members, any questions for no one who can answer? All right, good. Moving on. HB 2021 relating to health. Wait. Oh, sorry. Okay. Queen's Hospital, Queen Health Systems.
Morning, Chair, Vice Chair, members of the committee. John Garibaldi again with the Queen's Health Systems. We're going to stand on our written testimony providing comments. Thank you very much.
Okay, thank you. HMSA.
Hello, Chair Imani, Vice Chair Tam, members of the committee. Max Sasaki, HMSA. We'll send our written testimony and remain available for any questions. Mahalo.
Okay, thank you. Hawaii Association of Professional Nurses. No? Okay, no more? Oh, they're here, okay. Hawaii Association of Professional Nurses, do you want to get on? Bradley Cool.
Hi there. We stand on our written testimony already submitted, and we're here for any questions.
Okay, thank you. Okay, we have testimony from Ho'ola Lahui, Hawaii in support. Papa Olak Lakahi in support. Hawaii Association of Health Plans providing comments. Anybody else wishing to testify on this matter? Okay, seeing none. Members, any questions?
Chair, I have a question.
Oh, Representative Ward.
Thank you. I think it's probably to HMSA or one of the providers. Being that we have 5,000 licensed physicians, I'm wondering, is this about Viagra or cannabis for the guys who aren't in Hawaii? I'm trying to see what the supply and demand or the need is here. Any providers who are for this? HMSA, are you there?
Hi, Rep Ward. This is Matt Sasaki of HMSA.
Yeah, Matt. What's the need here? You got there's 10,000 licensed physicians. 5 are here and 5 are on the mainland. Is it because these guys are not meeting the need or they don't want to participate or what?
I can't speak to all the elements as if I'm a provider. Our concern primarily comes from just the ability for controlled substances to be overprescribed in this market.
It's about opioids then.
Yes, there's a variety that we just have some concern on, which relates to the comments that we submitted.
But if that's the case, this bill probably would be a negative effect rather than a positive one. If you're trying to control things, this is opening it up to you guys this person can be sitting in Roanoke, Virginia, and doing cannabis and opioids. Contrary to what you just said.
I apologize, Rep. I don't know if that's contrary to what we said. I think we just have concerns on that if this bill were to pass, it would allow for proliferation potentially of controlled substances. And that is where part of our concern lies in our comments.
So I didn't see your testimony, but you're for or against the bill?
We just provided comments in regards to the bill with concerns.
Anyone else care to comment? Otherwise, I'll go back to you, Chair.
Okay, I guess it comes back to me. Thank you, Representative Ward.
Okay, the ball's back in your court.
All right. The chair has questions. Queen's Health Systems. I just wanted some clarification in regards to the reference to the Ryan Hyatt Act provision that there might be some conflicts. Can you please expand on that, please?
Unfortunately, sir, I do not have those specifics, but I can get back to you in your office with more details regarding that.
Yeah, thank you, because I know that's referenced. And then, thank you. And then to HMSA, Mr. Sasaki, just to clarify, to clarify, I guess the question or the concern is that because of the opioid, right, the schedules 3, 4, and 5, that this may then allow outside prescriptions to be given and then intentionally maybe proliferate the opioid epidemic here in the state?
Yes, Chair, that is correct.
Okay, thank you. Okay.
Thank you, Chair.
Members, any additional questions? Okay, seeing none, moving on to HB 1980 relating to telephonic services. Department of Human Services.
Good morning, Chair. Judah Murray Peterson. On behalf of the Department of Human Services, we stand on a written testimony supporting the intent of the bill and offering comments.
Okay, thank you. Good. DCCA.
Good morning, Chair Yamane, Vice Chair Tam, members of the committee. My name is Colin Hayashida, Insurance Commissioner for the Department of Commerce and Consumer Affairs. The department stands on its written testimony offering comments. I would just also like to add that we are willing to continue a dialogue on this bill should the bill move forward. Thank you, Chair.
Thank you very much, Commissioner. Okay, HMSA.
Hello, Chair, Matsusaka to HMSA again. We submitted testimony in strong support of this bill and will remain available for any questions.
Okay, thank you. Hawaii Association of Hawaii Healthcare, Hawaii Healthcare Association of Hawaii. Paige.
Good morning, Chair. Thank you. We'll stand on our submitted comments and just thank you to the legislature for your continued support of telehealth in Hawaii. Thank you.
Thank you, Paige. Okay, Dr. John Souza, Hawaii Island Association of MFTs.
Aloha, Chair Yamane and Vice Chair Tam and members of the committee. Thank you so much for taking my testimony. And I just want to say, wow, your jobs are so hard and it's amazing what you do here. This is my first experience in this process and I really am humbled by what you have to do here. So thank you. And thank you for bringing attention to the telehealth issue and the telephonic issue specifically. We'd like to be able to get behind this bill and just make sure that it has a positive net effect on the access to mental health care services and ensure that it doesn't inadvertently discriminate against the elderly, low income or rural clients. Being a provider on the Big Island, I've often seen that it could inadvertently do that. Also, some of the limits with the 6-month in-person requirement could be difficult for those of us that just provide telehealth services solely. So again, I just want to say mahalo to you all for what we're doing to improve the access and quality of care here in Hawaii.
Yeah, thank you. Okay, Queens Health Systems.
Morning, Chair, Vice Chair, members of the committee, John Garibaldi again with the Queens Health System. We're going to just stand on our written testimony, providing comments. Thank you very much.
Thank you. Hawaii Pacific Health.
Good morning, Chair, Vice Chair Mike Robinson, Hawaii Pacific Health. HPH also provides comments. We are generally supportive of reimbursement for telephonic services, primarily for 2 reasons. I know this bill deals primarily with behavioral health, but the same challenges that are providing access issues in the behavioral health, we know firsthand as an acute care provider are the same challenges that provide access in acute care. So philosophically, we support telephonic reimbursement. And then secondly, we want to always make sure that our state legislation is in conformance and harmonized with federal rules and that nothing is done at the state level that would either hamper or prohibit or be out of sync with what the feds are requiring in other payers. So we provided comments that will hopefully address those concerns. And our main concern is not to foreclose the opportunity for telephonic reimbursement to be provided for providers. I think it's really needed in this community, and I think this bill is a step in the right direction. Thank you. We'll stand in our written comments otherwise.
Okay, thank you, Mike. Okay, National Association of Social Workers.
Aloha, Chair, Vice Chair Becky Gardner on behalf of the National Association of Social Workers Hawaii chapter. NSAW Hawaii is delighted to see that this proposal has been introduced and is being heard by the committee. This signifies an important recognition that there are vulnerable populations out there that cannot be reached by telehealth, and we need to enable a mechanism so we can connect with those perhaps who are in rural areas who can't afford the equipment, the technological, the broad bandwidth to be able to connect on telehealth. So we appreciate what this signifies, which is, I guess you can call it sort of a carve out to allow telephonic contacts. We do have some concerns, some comments on some of the specific provisions in here, namely the requirement that the telehealth mechanism is technologically unavailable. We think we need a bit more information to define what unavailable means, because we have patients in all sorts of circumstances. Some of them are elderly and they just don't feel comfortable using Zoom. So is that considered unavailable? So we need to iron out some questions like that. Also, some requiring a in-person meeting every 6 months, I think is very appropriate for physical ailments, but in highly subjective contexts, like in mental health, perhaps 6 months is arbitrary, and instituting a requirement may create a chilling effect, preventing people from seeking care because they just can't physically get to the office, especially while there are pandemic rules in place. Also, we have a meeting with HMSA tomorrow. I see Matt Sasaki here. So we are
Okay, Becky, can you wrap up your comment in the next minute? Sentence.
Yeah, we are eager to continue this dialogue and to make this proposal work. So thank you for your time, committee members.
Thank you. Hawaii Psychiatric Association.
The Hawaii Psychological.
Oh, sorry, Psychological Association.
Okay, that
Go
would
ahead.
be me then.
Yeah,
I'll go
there you
ahead.
go. Sorry. Okay, all yours.
Okay, well, I want to thank you for introducing this bill, which recognizes the importance of audio-only sessions in order to meet the needs of our most vulnerable population, the elderly, those in rural communities, those who cannot afford broadband. You know, in order to best ensure that the intent of this bill is met, we propose using the language that the Centers for Medicare and Medicaid Services use that includes audio-only sessions as part of the definition of interactive telecommunications system. I think this allows for flexibility to make sure that the people that need the service get it. And there's some examples. Somebody with a social phobia, for example, maybe video is available, but they're just more comfortable with audio. Or somebody who has a video, but they have their eyesight is declining. Maybe they lack the manual dexterity. You know, this would allow flexibility for the clinician and the patient to decide what is best for them. You know, CMS they looked at all the potential pitfalls, the costs, fraud issue, and Medicare decided to fully cover it, as does several other insurance companies in Hawaii. But we support the bill, and we think it'll help meet the needs of our most vulnerable populations. So thank you very much.
Okay, thank you. Kaiser Permanente. Mr. Ching? John? You on? Either John? Are you muted? The Kaiser didn't pay their telehealth bill and then cut off? No?
We'll stand on our written comments.
Okay, thank you. All right, AARP.
Thank you, Rep. Yamane. We paid our telehealth bill. Aloha, I'm Kaylee Lopez, State Director for AARP Hawaii. We support the intent of this bill and look forward to it moving out of your committee for additional work as needed. The only thing I'll add is a little bit of concern in the bill related to it only being used, audio only being used if other technologies are not available. We'd prefer to see that it's used in instances where it's the patient's choice or preference. Again, I think one of the things we all want to do is reduce and eliminate barriers to access. And I think that's a very important one. And look forward to this moving forward. Really appreciate your taking this on, Chair Yamane.
Okay, thank you, Director. Okay, Eric Abe.
Yes, hi, Eric Abe for the Hawaii Primary Care Association. I'll summarize. You have a written testimony Regardless of what happens today, the federal government will still require telephonic telehealth to be provided for Medicare and Medicaid recipients. Because of this, why shouldn't private insurers be made to do the same thing? Thank you.
Okay, thank you. Okay, anybody else wishing to testify? Seeing none, members, any questions?
Chair, Ward and Hawaii.
Representative Ward?
Thank you. I have some metric questions to either Queens, Kaiser, HMSA, Hawaii Pacific Health, etc. What is the percentage of business, if you will, that is telephonic and then telehealth? It's obviously growing. Do any of you have any trend lines in that regard? How much of this
Chair Jonathan Ching from Kaiser.
Thank you, Jonathan.
We put it in our written testimony, Representative Ward. So yeah, we've continued to see it. I mean, a rise. Clearly more telephone than video visits. You know, from 2019, you know, we've been offering these modalities, you know, even prior to the pandemic, but obviously with the COVID-19 pandemic, we saw that drastically rise. So in our testimony, it's just continued to rise. You know, the biggest jump has been the use of with patients seeing their provider with video. Specifically,
Jonathan, can you give some numbers? I don't
so
have the
I mean,
testimony in front of me.
telephone 2019 telephone visits for us was about 450,000 calls. And then moving up to 2020, it moved up to 777,000. That's kind of where it's been about the same. But like I said, the rise has really been video. We were doing like 1,000 video visits, and that's jumped up to like 60 to 70,000, you know, since the pandemic.
But I'm trying to compare it to what is it versus the normal, you know, the traditional classical, you walk in, you check in, you get to see the doctor. From those treatments to what you're now doing technologically, telephonically, or telephonically, or
I mean, really, since you know, there's been some people are more comfortable seeing their healthcare provider. You know, the in-person visits really have continued to continue, but you know, there's instead of for people who don't want to go in, you know, those modalities are there. And so, you know, our testimony really highlights that, you know, we want to have different type of modalities available so people can access care.
Is it 10%, 20%, 30% are doing it technologically?
I got to do the math. I don't want to give a round figure.
Nobody's got, I mean, I don't want to give any proprietary, how many's got more customers or whatever, but it's good to know because I think it's being utilized and utilized very, very correctly. The second metric is are these things available on the weekend by law? Chair, this may be to you because I had somebody who had COVID over the weekend and they tried to do it telephonically. He said, well, you got to come in on Monday. Are these prescribed telephonically or telepathically by open on the weekends? Or are you guys open on the weekends, HMSA and others, or Queens and Kaiser?
Aloha, Rep. Ward. This is Matt Sasaki out of HMSA. I won't speak on behalf of the other providers here, but our telehealth platform is available 24/7, both as a telehealth modality and supporting to refer patients who do need care in a physical setting to one of our healthcare provider partners. Thank you, Rep.
24/7. That's good to know. I'm assuming that's probably a standard. The last question is telephonic and telehealth charged the same rates? i.e. reimbursement. Matthew, you want to jump on that one?
I can touch on that probably. Right now, telehealth and telephonic are not reimbursed at the same rate. A big element behind that is also just understanding that there's a certain spectrum of care delivery and appropriate clinical necessity based on the acuity level. So with respect to that, there is not a parity in reimbursement.
I'm trying to say, can the state save money by doing or promoting one or the other? Or can the individual client say, look, I'm going to save money. I'm not going to go in person. I'm going to go by telephone and I save money. I'm looking for the structure of incentives in terms of utilizing this.
Yes, I think there is a possibility for that. I don't want to speak on that specifically because I think there's a lot of open questions to that. But we can have more discussion on that.
Yeah, it might be better offline because it's got rates, et cetera. Okay, thank you, Chair.
Okay, thank you. Representative Capella.
Thank you very much, Chair. I have a question for Dr. Souza, if he's still on, from the Hawaiian Islands Association for Marriage and Family Therapy from the Big Island.
Yes.
Hi. Hi, Dr. Souza. I have a question about how many patients, and I don't know if you can disclose this, have you never seen in person? Being from the Big Island, I know how rural it is and how difficult it is to find a therapist, period, and then be able to get the service, be able to create the Zoom or create the telephonic service that you need. Do you have any patients that you've never seen in person?
Yes.
So how many patients do you think would not be covered if the bill stands as it currently is, where you have to have seen this person in person in order to have coverage within the last 6 months?
All of them, because I am a solely telehealth provider, as is everyone in my practice.
Okay, thank you.
It's a great question. Thank you.
Okay. The chair's question is, so this would go to either or all three, HMSA, Queens, and HPH. In the requested amendments, there was a request to make it longer for the prior in-person visits in order to qualify. You guys want to explain, since your testimony is all consistent, the value of that? Matt, Mike, or no?
I'll defer to Queens on that question. Our comments, although we're in agreement with that, our comments were tied more to the other edits on their on the language.
Okay.
And Chair, this is Matt with HMSA. Similar to Mike, I will defer to Queens on the specificity of that request, but we do agree that there is an amount of time that should be allowed in between face-to-face visits, just to respect the modality of care. Thank you.
Okay, thank you. Queens then?
Yes, sir. Unfortunately, right now, I do not have that answer for you, but I can get back to you in writing. I think JC, we can just get back to your office regarding that.
Okay, all right.
Thank you.
Actually, Representative Yamani, I looked at my notes. It's tied to the Medicare, making sure that it's harmonized with the Medicare rules. It was my recollection of that.
Right, okay, so just to clarify, because I think that's what it was being alluded to, is that asking for the more time would then make it consistent with the potential federal regulations as indicated. Was that also hinted by CMS, or did CMS make a determination for the Medicaid side? Does anyone know? No?
The proposed rules, Chair, that this Judah Moore Peterson, MedQuest Administrator, the proposed rules are specific to Medicare, not to Medicaid.
Okay.
The Medicaid rules are actually very different. Thank you.
Oh, okay, thank you. Okay, so Representative Capella.
Thank you so much. For Matthew Sasaki, in your testimony, you say that
This says you called.
Representative Ward, you're on mic. Okay, go ahead, please continue.
Thank you so much. In your testimony, you provided the 12 months prior to telephonic services, provided that nothing in this section shall be interpreted or to require or prohibit coverage for any telephonic services. So am I correct in interpreting that if this language were to be added in replacement of section 3, would Dr. Souza's patients then be covered for their services?
Thank you for the question, Representative. So the language that we've added does allow the ability for reimbursement of telephonic delivered services for behavioral health.
Thank you. Thank you, Chair.
Okay,
Thank you, Rep.
Thank you, everyone. And then the chair would like to again thank HMSA if they can continue with the hospitals and the other providers to continue the discussion to continue to improve the bill. Thank you. Okay. Moving on to HB 2032 relating to health. Office of the Auditor.
Good morning.
Hey,
My name's Les Kondo. Good morning, Chair. My name's Les Kondo. I'm the state auditor. Thank you for entertaining our comments about the bill. We have some concerns about the bill. It is that from our perspective, it appears that we're being asked to do a study about private organizations If I look at our constitutional and statutory mandate, it seems like the authority is limited to state organizations and county organizations. I also want to make the point that this is a study and it's not an audit. And I think from my perspective, the value we bring really, what's in our wheelhouse is audits. It's assessing the performance of state agencies, state programs, how they're performing, whether they're performing their mission ethically, efficiently, effectively. These are programs that the legislature establishes and funds. So I think that that's where our value lies, is helping the legislature understand how those programs are performing. And perhaps this study is not within that wheelhouse. Anyway, thank you for considering the comments. If you have questions, I'm happy to answer them.
Okay, thank you. Okay, Department of Human Services. Judy.
Aloha, Chair. Judy Moore Peterson, a MedQuest administrator. I'm being blocked from turning my video on, so I apologize for that. That's okay. So, there we go.
There you go.
Thank you. On behalf of the Department of Human Services, we stand on our written testimony offering comments with concerns.
Okay, thank you. HMSA.
Hello, Chair Matsusaka, HMSA. We submitted testimony in regards to this bill and stand on our comments. Thank you.
Okay, thank you. Democratic Party of Hawaii.
Good morning, Chair Yamani. Good morning, Vice Chair Tam and members of the Health, Human Services, and Homelessness. My name is Melody Aduha, and I'm Chair of the Health Committee of the Democratic Party of Hawaii, and we stand in strong support of HB 2032. The Medicaid Managed Care Organizations is a $2 billion a year business. 20% of the state's budget is attributable to MedQuest. The MCOs and the health insurance keep all the funds left over after they have released funds for actual medical care, which they call medical losses. Such structure creates an inherent conflict of interest. The Medicaid MCOs have never been audited in Hawaii. As far as we are aware, no audit reports are publicly available. Given the huge dollar amount and the federal contribution, it is irresponsible for the state government to fail to audit the MCOs year after year, especially because on the US mainland, auditors have found many types of misconduct by health insurance who operate managed care organizations that are very similar to Hawaii's MCOs, using techniques like upcoding of medical services, ghost networks of doctors where they are listed as being available to serve Medicaid patients. But when you call for an appointment, you've learned that they've retired, passed away, moved away, or just not taking any more Medicaid patients, despite insurance listing them as being available. Fundamentally, the MCO system allows insurers, rather than medical professionals, to make medical care decisions. Moreover, experience in several states have shown that switching from MCO management to enhanced primary care case management provides major improvements in three critical areas. Number one, improved patient care. Number two, better treatment of physicians and other medical providers. And number three, overall savings of taxpayer dollars. So we need an audit to help us see whether we
Senator, can you please wrap up in a sentence?
Yes, thank you very much, Chair Yamani. Yes, we do need to have this audit. Medicaid treats 4,000 Hawaii residents, which is about a third of our population. We have a doctor shortage of 1,000 doctors. We are in crisis, and we need to find out how we can improve on the system. And we have to start with this audit, or as Les Kondo has mentioned.
Right. Thank you. Okay.
And we are in accord to have it, the legislative reference.
Okay, moving on to Dennis Miller. Is Mr. Miller on? He is, okay.
Hi, can you hear me now?
Now we can, yes.
Okay, great. Should I start my video? I'm pressing OK on that.
Yes, please begin.
Okay, well, I guess I won't have video. That's okay, you can hear me.
Yep.
All right, so thank you very much for holding this hearing. I would like to say that while with respect to the auditor's comments, which make absolute sense, except that in this case, the state has hired the private contractor. So because the state has hired the contractor, that contractor is effectively a branch of government. And therefore, it should fall within the wheelhouse of the auditor. And if the bill implies a study, then that language must be changed to reflect what the auditor said is his skill set, and that is an audit. An audit is necessary because we don't know the real administrative costs of Medicaid. And we don't know it because some of the non-medical costs are allowed by law to be classified as medical. So when Director of MedQuest Hawaii, Judy Peterson, states that 93% of Medicaid dollars are spent on medical, she is withholding information from you, the legislature, about how much of that 93% is non-medical and can be cut. As evidence that there must be room to cut, look at the cause of Hawaii's doctor shortage. They were working until increases in payment complexity, which increased their cost of business because they had to buy new software and hire more medical billers. There is an increase in administrative costs, which can be cut. However, Judy Peterson denies that, and that is why you have to ask her in person today. Judy, how much of that 93% figure includes medical management?
Can you wrap up your testimony in one sentence?
We need an audit to find the true costs of non-medical costs in Medicaid, which can be cut, plus how much upcoding is going on in Medicaid. That is another major factor, which is overcharging the state. Aloha, thank you very much. Sorry for being nervous.
Okay, thank you. We have comment, testimony submitted by the Americans for Democratic Action in support. Health Committee, again, the Democratic Party in support. Will Karen support. Thomas Brandt support. Keith Neal support. Martha Randolph support, and Hawaii Association of Health Plans provided comments. Okay, members, any questions?
Chair, I have a question.
Rep. Ward?
To Mr. Miller's question. Ms. Peterson, are you there?
I am, thank you.
His question being that what is the percentage of the administrative cost, the 93% that have other admin things built into them that are not actually provided?
I apologize, Rep. Ward. Your question to me got cut off a little bit, and I was
sorry. It's basically Mr. Miller's question about of the 93% that is for medical. How many of those are categorized or recategorized, even though they're administrative?
Thank you. There's actually federal rules around how to categorize costs, and so there's the rules that I believe Mr. Miller, although I am not exactly sure of all the rules he's referring to or what costs he thinks are we're miscategorizing. But when we're looking at medical costs, the requirement for calculating those are to allow quality assurance and quality improvement activities to be included in the medical cost. I believe that is what he is referring to. I do not have that exact amount, but we are able to get that information for you because our actuaries actually do take a look and a very close look at all of the costs, including both the healthcare costs on the medical side, the quality costs, and the other administrative costs that the health plans do incur in operating operating the Medicaid line of business.
The follow-up question would be, what are the industry averages for the medical profession and the generally accepted percentage of administrative costs? Like if it's a small business, it shouldn't be over 18. Well, if it's a nonprofit, it should be 12%. If you're raising money, if you're otherwise 15 to 20%, shouldn't go beyond administrative. Are you kind of within those guidelines or are you under it?
We're below those. Yeah, currently we're below those. We're between 8 to 12% administrative costs, and depending on the challenges or the overall healthcare costs, In the past couple of years, it's actually been much tighter than that. It's been 4 to 5%, which are likely not sustainable over the long
Right.
run, being able to administer the business.
My last question, Chair, if I may, is underlying the question is, hey, can we save any money in our healthcare providing that we do through Medicaid? Any room for that, Ms. Peterson?
We can always look to provide cost savings, et cetera. The fact is that the majority of our costs are on the health and paying for services and paying for healthcare and medical services. And the majority of those costs are actually within the hospitals and within the nursing facilities. I believe that if you asked either of the hospitals or the nursing facilities, they would argue that despite them being the highest proportional cost that we have currently, that they would that we, the Medicaid program, are likely underpaying them for the services and the costs that they are incurring.
Thank you, Ms. Peters. Thank you, Chair.
Okay, thank you. Members, any additional questions? Okay, the chair has a question for Judy Moore Peterson. In reference to the question regarding the audit looking at services, performance, quality, and pricing controls, is that currently being provided under the external quality review reports that you have to submit to CMS?
Yes, we have a series of reports that we have to submit to CMS and that we do ourselves. We have the external review organization looks at the performance and looks at the quality performance metrics of all the health plans, and they do it in a 3-year cycle. They make sure that that utilization reviews are appropriate, et cetera. Our actuaries actually review also all the data and the quality of the data that's coming in. They're looking at the administrative costs. We have to submit all of that to CMS as well.
Is that public? Can the public get that information to review the performance of Hawaii Quest MQD?
Most of it is public. Some of it is proprietary, but most of it is public, and we are able to provide it.
Okay, so if there's a question regarding quality or area, reimbursements, utilization, performance, that can be accessed currently through the CMS web portal, or does it have to be specifically requested?
It can be requested. We have some of the information available on our website, and then some of the information CMS also has available on their website.
Okay, all right, thank you. Okay.
Thank you.
Okay, members, moving on to HB 1975 relating to healthcare preceptors. Department of Health. Okay, anybody there? No, mask on too tight. All right, Department of Health, if you are able to get on, we'll move on to the Hawaii State Center of Nursing.
Morning, Chair Yamane, Vice Chair Tam. Thank you, and we stand on our written testimony.
Okay, thank you. Awesome. Okay, Queens Health Systems.
Good morning, Chair, Vice Chair, members of the committee. John Garibaldi with the Queens Health Systems. We're going to stand on our written testimony in support. Thank you very much.
Okay, thank you. Dr. Withy from JAPSIM.
Good morning, Chair Yamane and members of the committee. We're going to stand on our testimony. This is a successful program that I really thank you for starting, and we just want to do some housekeeping.
Okay, thank you. Okay, Tax Foundation of Hawaii.
Good morning. This is Jade McMillan for Tommy Machika and the Tax Foundation of Hawaii. We will stand on our testimony. Thank you.
Okay, thank you very much. Okay, Kaiser Permanente.
Morning, Chair. Jonathan Ching for Kaiser Permanente. Will stand on our written testimony and support.
Okay, thank you. Hawaii Association of Professional Nurses.
Hi there, Rep. Yamane and committee. I'm Bradley Kuo with the Hawaii Association of Professional Nurses. We already submitted our testimony. We stand on our submission, and we're here for any questions.
Okay, thank you. Okay, oh, last chance. Hawaii Department of Health.
I think he's busy getting the tax forms out to the preceptors right now.
Okay, well, all right. So, Budget and Finance provided comments. Department of Health did provide testimony and support. Hawaii Pacific Health support. Hua Moon Women's Health LLC support. Hawaii Primary Care Association support. Kathleen Yokuuchi in support. Patricia Balick support. Catherine Firm support. Julia Lindberg support. Rick Ramirez in support. Samuel Former support. Colin Bass in support. Any members have any questions? Okay, seeing none, moving on to HB 2424 relating to child welfare services. Let's see, let's call the Department of Human Services.
Aloha, Chair, members of the committee. This is Kathy Betts, Director for the Department of Human Services. We stand on our written testimony, supporting in the intent and opposing in part. And DC Hartsfield and I are available for questions if there are any. Thank you.
Thank you, Director. Okay, we have Noho Botello.
I'm here.
Okay, go ahead, please begin.
Aloha, my name is Ninohe Botello. Thank you for Chair, Vice Chair, and members of the committee for hearing this bill. I'm an independent consultant to victims and to their surviving families of homicide. I have been working with the Ariel Sellers family, AKA Isabella Kalua, since the story broke about Isabella. I am supportive of the intent of this bill in terms of having more funding and for foster children and foster children currently in the process and adopted children. And I do support partly the intent of having more workers and spending more money on increasing outreach to the communities on this issue. However, my concern is that still, we don't see anything in this bill, and maybe it will come along later, but relating to any kind of monitoring or accountability to already the social workers already involved in cases like Ariel's, or including adoption. If we had more monitoring and accountability, we may not have seen the death of Ariel Sellers. We may not see the ramifications of not monitoring and oversight by Department of Human Services. So that's my concern. Otherwise, I support the intent of the bill to increase funding for social workers and other workers involved in DHS. But my concern, again, is the monitoring of these services when they're put in place. Thank you for your time.
Okay, thank you. Jenna Lynn Oda.
Hello, thank you for having me,
Please
Chairman
begin.
and Vice Chair Tam and the committee members. I am here in support of HB 2424. I am a current foster parent for 7 years. Part of the issue is we only keep kids for a minimum of 6 months and then they can be adopted out. So having the extra eyes on each child, whether it's working out with the family, if not, if they need more services, this bill will help provide that. On top of, we are battling COVID. So some of the kids are now homeschooled. So they're not able to tell a teacher or counselor that they might be experiencing some problems at home, abuse, things of that nature. So having people and more eyes on these kids is such a wonderful thing. And of course, we always need more money to help support and protect the vulnerable. So thank you very much for your time. I appreciate it.
Okay, thank you very much. Okay, Kimiona Kane. No. Okay. Mia Lisa Otis.
Hi,
Okay, please begin.
my name is Mia Lisa Otis, and I support Bill 2424. I'm testifying today with an angel on my shoulders, Ariel Sellers, formerly known as Isabella Kalua. This innocent girl could have been saved if measures like this were in place last year. Instead, on behalf of Ariel, I would like to make sure no other child goes overlooked. I want to thank the multi-agency task force that helps keep kids safe and help them heal. I worked with children for 19 years, including working at the Friends of the Children's Justice Center of Oahu. It's sad how many abused children I've seen, from sex abuse, physical abuse, neglect, and witnesses to crimes, yet so many more go unreported. It takes a village to report abuse, and like the previous testifier said, there's a problem with, going school on Zoom. According to the DHS APSR, every year there are thousands and thousands of child maltreatment reports. I understand CWS is short-staffed, and a crisis mobile outreach team will have the authority to intervene, and that's how we can save our kids from further abuse. Funding and hiring more CWS workers will help ensure that more innocent children don't fall between the cracks behind closed doors. I trust and know that there are a lot of social workers out there with big hearts to continue the job and at hand. Ariel's life has really touched the community of Waimanalo and beyond, and so has the lives of, let's say their names, Peter Boy, Shaylin, Cyrus, Grayson, Kitana, Fabian, and countless other innocent children. Before we lose another Keiki, let's please adopt these laws. Let's get more eyes on our kids by appropriating more assistance and funding for the CWS positions. Mahalo.
Okay, thank you. Okay. Ingrid Peterson. Ms. Peterson, are you there?
Yes,
Okay.
hello, committee members. I'm a longtime Kailua resident, and I just strongly support you to pass this bill or move it forward for Ariel's sake, so we can hope to prevent another tragedy like that. And I think that's all I have to say. Thank you so much.
Okay, thank you. Okay, Attorney Generals.
Hi, good morning. James Walther, Deputy Attorney General. We are in support of the intent of this bill, and we have offered comments that point out potential challenges. And we've also offered a suggested revision to address those challenges. And I'll be available for questions. Thank you.
Okay, thank you. Okay, Kim, oh, we already said that. Okay. All right, so let me list those that just provided testimony in support. Budget and Finance, provided comments. Department of Health in support. Cindy Evans, Deborah Goodwin, Debbie Schatz, Marilyn Yamamoto, Debbie Schatz, Lori Tochiki, Jenna Lynn Oda, Michelle Ann K. Akana, Kehi Kahui, Creason Fujii, Kapua Medeiros, all in support. And we have testimony of Marilyn Yamamoto and Julie Tinsman in opposition. Members, any discussion? Or, questions? Okay, seeing none. The chair has a question for the director of DHS.
Aloha, Chair.
Good morning, Director.
Morning.
In this bill, there is a portion that is allocating direct funds to child adolescent mental health and the Department of Health, which is not here to testify or to answer questions for that. Is it appropriate that a section under CAMD would then be under your direction, under Department of Health, Department of Human Services?
Chair, I don't believe that they would be directly under my supervision, but we do agree that additional funding and expansion of mental health services for adoptive and legal guardianship children and their families are necessary. This
So
is
how
something
would-
that we support.
Okay, so how would this work then if they are social workers and a unit not in DHS but in DOH? How does that then coordinate with cases that fall under your foster care and adopted families unit that, you know, that you are required to monitor where CAMD is not, you know, responsible for those cases? How would this work since Department of Health is not going to handle?
Chair, that's a good question. We do work really closely in conjunction with CAMD and Department of Health. There are folks assigned to our active cases, and we work closely with them to monitor what mental health services are needed for our youth and for families. And Social Services Division Administrator Daisy Hartsfield is on here as well if she'd like to add anything.
Aloha Chair, Vice Chair, and members of the committee. The director is correct in terms of the coordination with Department of Health. They have their separate budget to provide mental health services, but internally we communicate with one another as to what types of services our foster youth require, and then we consult with them to try and work out what type of services are most appropriate. And if we need to, then we'll dip into our funds to provide those services. But most of those services are paid for through a DOH, specifically via CAMD.
Okay, so under federal law, there are certain protections that for all foster kids and these kids have. You can correct me if I'm wrong. Now, sharing that with Department of Health CAMD, is there any questions regarding that being challenged, since this is an issue about not only the services for the child, but also ensuring and monitoring the providers that give the services to make sure the families and the providers are following what's in the best interest of the child?
If I may, I believe what you're trying to get at is in terms of reimbursement, how we're gonna
well, confidentiality, you know, all those other things in regards to that affected this most recent and other cases in the past.
In terms of treatment, we can get authorization information. So because of the agreements we have as to what type of information can be shared, that's not necessarily an issue. So
so if a DOH, this crisis team goes out, are they then, and they see a situation, do they do like any other outside reporting, have to go through your DHS child abuse hotline, or because they are part of the state, the process would be immediate?
My understanding is because the referral will probably come from CWS, that they don't have to go through our intake hotline
Okay,
unit.
well, I'm talking about these DOH mobile units. That's not CWS, right? Isn't that CAMD?
That's CAMD, but they can work in coordination with CWS.
Okay, so we just need to make clear that then these DOH DOH then would be moved over to CWS?
That part I'm not sure about, Chair. I'm not sure how operationally that would work. We would need to look into that a little further.
Okay, and then what is the numbers of the amount of families impacted?
By the crisis unit or in terms of permanency?
Permanency, the whole bill. How many families are we talking about?
We're talking about over 3,000 children.
3,000 children. Okay, and out of the 3,000 children, how many children or families had some form of complaint
Against them?
Yeah.
It's very small. I would need to look for the specific numbers, but from what I recall, it's less than 10% of those families.
10%, okay. Okay. Thank you, members. Any additional questions? Okay, thank you. Seeing none, moving on to HB 1977 relating to dental assistance. Department of Health.
Good morning. My name is Matthew Shim. I'm Chief of the Family Health Services Division. The department stands on its testimony offering comments and an offered amendment, and I'm here to answer any questions. Thank you.
Okay, thank you. You didn't want to answer the other one, huh? Okay, Board of Dentistry.
Good morning, Chairman Yamane, Vice Chair Tam, members of the committee, Sandra Matsushima, Executive Officer for the Board of Dentistry. Stand on my testimony, providing comments. Thank you.
Okay, thank you. Hawaii Oral Health Coalition.
Hi, good morning, Chair Yamane, Vice Chair Tam, and members of the committee. My name is Patrick Donnelly, and I'm the Statewide Oral Health Coalition Manager for Hawaii Public Health Institute. The Hawaii Oral Health Coalition supports the intent of this bill. Personally, I've been able to witness the positive impact of community-based dental programs like teledentistry or virtual dental home. But currently, the viability of these programs is limited by the allowable workforce able to work under the general supervision of a dentist, which can hinder productivity, efficiency in implementing these programs. General supervision just basically allows members of the dental team to perform duties without having the dentist to be physically in the room. However, the dentist should still be available for guidance and consultation as needed. This bill would allow dental assistants to carry out only the essential supporting duties to assist the dental hygienist, in schools, community centers, nursing care facilities, and other public health settings, which ultimately increases the dental provider's capacity to provide the needed dental services in the community, especially to rural and vulnerable populations. The coalition would really like to see this bill move forward. And in order to see it serve its intended purpose of increasing access to dental services in the community, we've just proposed some minor amendments to the bill language in the written testimony regarding specifically supervision by dental hygienists and the employment of dentists. And going forward, I'd be more than happy to answer any questions you have regarding the intent of the bill or the amendments that we've proposed. Thank you all so much for the opportunity to testify.
Okay, thank you. Aloha Care.
Hi, Chair, members of the committee, Peggy Mirza with Aloha Care. We submitted testimony in support. I'll stand on that testimony. It includes some comments about the bill and some clarity. Thank you so much.
Okay, thank you. We have testimony submitted by Hawaii Dental Association support, Hawaii Children Action Network speaks in support, Hawaii Dental Hygienist Association in support, Hawaii Dental Services in support, Hui no Keola Pono in support, Michelle Tui support, Hillary Vindahar in support, Jennifer Lagagien in support, Amy Hajdak in support, Robin Check in support, and Leanne Higa in support. Members, any questions? Okay. No questions. Okay, moving on to HB 2393 relating to background checks. What's it? Human Services.
Aloha Chair, Vice Chair, members of the committee, Kathy Betts, Director for the Department of Human Services. We stand on our written testimony supporting the intent and providing some comments, and we are available for questions. Thank you.
Okay, thank you. Members, any questions for the director? Okay, the chair has some questions for the director. Okay, Director, you and I have been talking about this for since last year, right? So just to summarize then, from your testimony, you guys are requesting language to broaden the background checks to all employees, contractors, and volunteers. Is that correct?
Correct.
Okay. And then so any of those that service young adults, children, including those in foster care, you want to make sure are covered, right? So if
Correct
that is,
as well.
okay, so if that's explicit that we're addressing young adults, children, foster care, and it will impact all employees, contractors, and volunteers, that would be broad enough language to address the department's concerns?
I believe so, Chair. Also vulnerable adults, since we do also have interventions with vulnerable adults. also pointed out in our written testimony that there are a couple sections that provide for authority that we already have under HRS. So we clarified that in our testimony.
Yes, yeah. I think there has been some discussions about, there might be some value about re-emphasizing the necessity about background checks and its impacts in various sections. But I leave that to, various other entities. But okay, so just regarding the intent of this, right? Then this would be looking at background checks consistent and making it applicable for you guys, for employees, contractors, and volunteers for the protection of young adults, children, and vulnerable adults. Is that correct?
Correct.
Okay, thank you, Director. Okay.
Thank you, Chair.
Okay. Moving on to HB 1774, relating to the coverage for mammography. Okay. Insurance Division, Commissioner Hayashida.
Thank you, Chair Yamane. Insurance Commissioner Colin Hayashida for the Department of Commerce and Consumer Affairs. The department stands on its written testimony, offering comments on the bill. And I would also like to add that for clarity and consistency with other laws, we respectfully suggest 2 amendments. Those amendments are in our written testimony. Thank you, Chair.
Okay, thank you, Commissioner. Okay, Hawaii Medical Association.
Aloha, good morning, Chair Yamane, Vice Chair Tam, Lisa Ignacio, HMA. We stand on our written testimony and support and are available for questions. Thank you.
Okay, thank you. Okay, and Department of Health provided comments. Members, any questions? Okay, seeing none, moving on to HB 1945, relating to the Neighbor Islands Blind and Visually Impaired Service Pilot Program. Department of Human Services.
Good morning, Chair and members of the committee. This is Maureen Bates from the Division of Vocational Rehabilitation within the Department of Human Services. And we stand on the department's testimony provided, and I'm available for questions. Thank you.
Okay, thank you. Okay, we have from somebody from the National Federation of the Blind of Hawaii.
Yes. Thank you, Mr. Chair, Vice Chair, and committee members. I'm James Gashel. I know your time is very short. I'm going to stand on our written testimony. I just want to point out that this bill expands services to blind people on our neighbor islands, which the state admittedly can't do completely as much as this bill would provide. I want to say that this bill did pass the House in the 2020 session. It stopped in March when the Capitol was closed, and now this bill was not brought forward in last year because of budget concerns. It's been reintroduced now and supported by the Deaf and Blind Task Force, and mahalo for your consideration.
Thank you very much. Okay, and Ann Lemke. Okay, provide testimony and support. Virgil Stinnett.
Aloha. Can you hear me?
Yep.
Thank you for letting me speak on behalf of this measure. The reason I'm supporting this measure is there are a group of blind adults anywhere between, I guess, the age of 23 to just under the older blind division section. So, and these are blind adults that are not covered by DHS if they don't plan on being employed. And so Ho'opono is a service that provides training for blind adults that plan to become employed. And it's really critical for blind people because for independence and for any blind person is if they can get around and be trained just to minimally get around their own community, their home independently, is really a plus factor for them, and I think for the whole community. And then hopefully they decide that they want to become employed and they know that they can be, then they could go through the whole point of service program to then go through the process. But this pilot program, I believe, is really critical for the folks that DHS VR does not catch. Thank you for hearing me.
Okay, thank you. Okay, Katie Kim.
Katie?
Katie? Is she good in support? Yeah. Hello, can you unmute? Oh, you're gonna help her? Okay. Okay, members, thank you for your patience. We'll allow her to be able to speak. Okay, Katie, still can't hear you or see you. All right, we do have your testimony. So if you are able to connect before I get to the list, we'd love to hear from you. But for this measure, we have Department of Budget and Finance providing comments, Hawaii State Committee of Blind Vendors in support, Donald Sakamoto in support, Brandon Young in support, Deb Bremen in support, Algan Hygent in support, Hoku Burrows in support, Department of Health Executive Office of Aging provided comments, and Katie Kim provided testimony in support. Any chance? No? Okay. Yeah, but we can't hear her or see her. So we want you to know we have your testimony. Sorry, we're having some tech not working. Members, any questions? Okay. Seeing none, we will be recessing this agenda for decision making at 11:30. Okay, thank you. In recess. Right. Reconvening the Committee on Health and Human Services and Homelessness for the purposes of decision making on this morning's 9 a.m. February 3rd, 2022 agenda. Members, first measure is HB 1581 relating to homelessness. Members, talked with the introducer and vice chair. We're going to move this measure along at his request to continue to work on it. However, we are going to take out the reference to exemptions for criminal liability, and we're going to specify that the intention for the civil access is for the issue of trespassing. Okay, and we're going to give it a 7/1/2060 effective date. Is that amenable to the vice chair?
Yes, thank you, Chair.
Okay, thank you. Okay, any discussion, members? Okay, seeing none, vice chair.
Loyal House Bill 1581, Chair's recommendation is to pass with amendments. Vice Chair votes aye. Chair?
Oh, aye.
Rep. Gates is excused. Rep. Parr?
Aye.
Rep. Capella?
Aye.
Rep. Nishimoto?
Aye.
Rep. Ward is excused. Chair recommendation is adopted.
Okay, thank you. Moving to HB 1406, relating to improving access to psychiatric care for Medicaid patients. Members, the recommendation of the chair is to continue the discussion, move this measure forward as an HD1 we're going to include tech changes and an effective date of July 1st, 2060. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1406, Chair's recommendation is to pass with amendments, noting the excused absence of Rep. Gates and the.
Oh, he's there now.
With Rep. Gates and Rep. Ward now present, we now have a full quorum for the committee. So any reservations? Any no's?
Ward here?
Ward's here.
Okay, okay, thank you.
Chair's your recommendation is adopted.
Thank you. Okay. Moving to HB 1638, making an appropriation for a Kona Hospital site assessment. Members, the recommendation of the chair is to move this measure forward with tech changes and a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1638, Chair's recommendation is to pass with amendments, noting all members present. Anyone with reservations? Any no's? Chair recommendation is adopted.
Okay, thank you. Members, moving to HB 2021 relating to health. Members, this might have some unintended consequences regarding the outside, out-of-state prescriptions. I think it needs a little bit more work, so we'll defer this measure at this time. Moving to HB 1980 relating to telephonic services. The recommendation of the chair is to move this measure forward as an HD1. Members, we're going to incorporate the recommended language addition submitted by the hospitals, like because they are similar, which was Queens, HPH, and HMSA. We're going to include that text into the bill. There are amendments. We're going to do some tech amendments, and we're going to give it a July 1st, 2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1980. Chair's recommendation is to pass with amendments, noting all members present. Anyone with reservations? Any no votes? Chair recommendation is adopted.
Okay, members, moving on to HB 2032 relating to health. Members, after hearing the testimony from the auditor and the department, the chair is going to recommend defer this measure at this time. Okay, moving on to HB 1975 relating to healthcare preceptors. Members, the recommendation of the chair is to move this measure forward as an HD1. We need to make some tech changes and put in a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1975, Chair's recommendation is to pass with amendments, noting all members present. Anyone with reservations? Any no votes? Chair recommendation is adopted.
Okay, members, moving on to HB 2424 relating to child welfare services. Members, the recommendation of the chair is to move this as an HD1. Before I get to substantive changes, members, the preamble, which is located on page 1, 2, 3, and most of half of 4 will be deleted. So the purpose of the act will be at the beginning. Members, in light of the fact that Department of Health, CAMD, made no attempt to be present to ask questions or to address the issue of them being under the direct supervision and monitoring of DHS, we will be deleting language pertaining to the mobile crisis unit under the CAMD program and the language, the appropriation language directed for that. Members, we're also gonna make it clear and add language that this will be pertain to those that have had a complaint reported to them by some entity or individual throughout their time as a foster parent, adoptive parent, or under taking children under the care of the state while they've been taking state financial support. Okay, and it will be giving it a 7/1/2060 effective date. Members, any question? Okay, so then members, this will then bring it, instead of over 3,000 potential families impacted, it'll be those that have some type of complaint. So that should make it down to about 10%, make it much more manageable and effective. And that should address some of the department's concerns. Okay, so moving that HD1, Vice Chair, please take the vote.
Voting on House Bill 2424, Chair's recommendation is to pass with amendments, noting all members present. Anyone with reservations? Any no votes? Chair, your recommendation is adopted.
Okay, thank you. Awesome. Members, moving to HB 1977 relating to dental assistance. Members, the recommendation of the chair is to move this measure as an HD1. We are going to be taking up the preamble located on pages 1, 2, and pages 3 up until line 11 will be deleted. Members, we will put in effective date of July 1st, 2060. We have some tech changes, and we're also going to incorporate Department of Health's recommended amendments. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1977, Chair's recommendation is passed with amendments, noting all members present. Any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Moving to HB 2393 relating to background checks. Members, this is a measure that was brought up, that came up last year in light of several situations. So we would like this measure to move forward. We're going, in light of what the department has requested, we're going to be adding language that broadens the background checks for all employees, contractors, and volunteers who have in some contact or serve young adults, children, and vulnerable adults, including those in foster care. So that type of language will be inserted to make sure that we have a broad spectrum of both employees, volunteers, as well as the clients that they serve. We need to put in some tech amendments and put a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 2393, Chair's recommendation is passed with amendments, noting all members present. Any members with reservations? Any noes? Chair, recommendation is adopted.
Okay, thank you. Moving to HB 1774 relating to coverage for mammography. Members, the recommendation of the chair is we will move this measure forward as an HD1. We're going to incorporate DCC amendments. We need to make technical amendments and a 7/1/2060 effective date. Oh, that's it. Okay. Oh, and we're going to take out the preamble. Okay. Okay, members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1774, Chair's recommendation is to pass with amendments, noting all members present. Any members with reservations? Any noes? Chair, recommendation is adopted.
All right, another Women Caucus bill moves forward. Okay, moving to HB 1945 relating to the Neighbor Islands Blind and Visual Impaired Service Pilot Program. Members, recommendation of the chair is to move this measure forward as an HD1. Members, we will also delete the portion of the preamble, pages 1 and part of 2 up to line 7. We're going to need to make some tech amendments and put a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1945, Chair's recommendation is to pass with amendments, noting all members present. Anyone with reservations? Any noes? Chair, your recommendation is adopted.
Thank you, members, for all your patience and assistance. We're adjourned. Thanks, Chair.